So good day everyone. Our topic today is about the impact of technology, and this topic is still part of the organizing phase in the management process. For today's session, these are our learning objectives. First, to articulate the role of technologies in patient safety and describe the core components of informatics, data information and knowledge. Analyze three types of technology for capturing data at the point of care. Discuss decision support systems and their impact on patient care. And explore the issues of patient safety, ethics, and information security and privacy within information technology. Technology in healthcare has increased at an exceptional rate in recent years, and it will continue to play an important role in the realm of healthcare. And when we talk about healthcare technology, it is defined as the use of technologies developed for the purpose of improving any and all aspects of healthcare system. It could be in the form of a vital signs monitor. Again, it's a technology. It could be in the form of electronic health record. Again, that's technology. And even with the use of robotics in healthcare, again, that's a product of technology. Now, healthcare technology, when used properly, have the potential to improve patient outcomes and nurse productivity. And the literature has identified four major advantages of using these technologies in healthcare. One of these advantages is facilitates decision making. In particular, the use of clinical decision support. We're talking about systems. It could be a computer system. It could be an apps that help professionals make clinical decisions related to patient care. And we're gonna talk about clinical decision support in our next few slides. Another advantages of these healthcare technologies is that it improves efficacy and efficiency. And we're talking about the use of infusion pump. How does it save time of nurses in providing medication or IV fluid to their patient? It could be in a form of physiologic monitoring devices, which is very helpful for nurses. Try to imagine several years ago in which these monitoring devices have not been invented, and it would take a lot of time on the part of nurses and healthcare workers to monitor their vital signs without the aid of this technology. Another advantages would be it enhances patient safety. One of the most important technology developed to promote patient safety is the barcode technology when giving medication to your patient. And this is very important because with this type of technology, we are actually preventing medication errors. Again, that is patient safety. And of course, decreases healthcare cost. With the rise of telehealth, with the advances in some technology related to consultation, such as the virtual consultation, which is much cheaper than the actual in-person consultation. Again, it decreases healthcare cost. With the rise of healthcare technology, nurses and student nurses are expected to possess critical competencies in managing and handling healthcare technologies. It is not a surprise that the Quality and Safety Education for Nurses has identified several competencies that a student nurse should develop during nursing education and training. And one of these competencies is informatics competency, which refers to knowledge, skills, and attitudes related to the use of computers. And again, as I've mentioned earlier, this is included in the nursing curriculum. This is also the reason why nursing students has to take courses related to informatics. And another thing is that the Tiger Initiative Technology Informatics Guiding Education Reform, again, this is another agencies which has the mandate of making sure that nurses and student nurses are equipped with the necessary technological competencies. Now, These agencies has also identified informatics competencies that all practicing nurses and student nurses should develop, such as, for example, basic computer competencies. We also have information literacy and information management. As nurses, we commonly use and manage three types of technologies in the clinical setting. We have biomedical technology, we also manages information technology, and last is knowledge technology. When we talk about biomedical technology, we're talking about the use of equipment in the clinical settings for diagnosis, physiologic monitoring, testing or administering therapies to our patient. And when we talk about physiologic monitoring, we have the vital signs monitors. It could also be oxygen saturation devices. We also have monitors for central venous pressure. Even the ECG and EEG machines and fetal monitors are examples of biomedical technologies which are used to monitor physiologic processes. Now, when we talk about diagnostic testing, there are certain equipments, technological equipments in the clinical area that helps providers or doctors to diagnose certain conditions. Again, the ECG and EEG is very important because it helps in the diagnosis of certain conditions. We also have lab testing devices used to diagnose certain diseases in patients' blood, in patients' urine, and other specimens. Again, these are all products of technology. And when we talk about IV fluid and medication administration, we have IV pumps to deliver fluids, to deliver blood and blood products. Again, these are examples of biomedical technology. And of course, the last but not the least is therapeutic treatment. Again, when we talk about therapeutic treatments, we're talking about, for example, mechanical ventilators to support the respiratory function of our patient. Again, that is a form of technology. And we also have fetal monitors to monitor the condition of the fetus while inside the womb of the mother. Again, these are examples of biomedical technologies that we use in the clinical area. The second type of technology that we commonly use and manage in the clinical area is the information technology. And information technology is very important because in the healthcare settings, information technology has the following advantages. It is very useful in acquiring information and knowledge. It is also very important in managing, analyzing, and disseminating information and knowledge in the clinical area. And one of the most important examples of information technology in the clinical area is the use of patient electronic record, which can provide rich information about the patient that could be used to improve patient care and provide treatment recommendation to the patient. The third type of technology in healthcare is knowledge technology, and it pertains to systems that generate or process knowledge and provide clinical decision support. Now, in this type of technology, clinical knowledge, it could be the vital signs of the patient, it could be the signs and symptoms, or it could be the lab results. These are clinical knowledge. These clinical knowledge are embedded into the computer system, okay, to make clinical decisions to enhance patient care. Now, just try to look at the slides in front of you. Notice that relevant patient data, for example, patient's current medication, or patient-specific information. It could be signs and symptoms of the patients or any clinical manifestations, or it could be drug information and knowledge bases and guidelines. These informations are embedded into a computer system, and with the aid of artificial intelligence, these are automatically analyzed. And in here, through analysis, an alert, or it could be in the form of reminder, or it could be a form of recommendation, will be developed or will be generated that would aid healthcare providers in making decisions or treatments related to patient care. So how does clinical decision support system work? On the slide right now is a sample workflow for an artificial intelligence-based clinical decision support system. Again, this is an example of knowledge technology. Now, if you would see in the PowerPoint slide right now, after the initial patient-provider contact, the data collected upon assessment, it could be in the form of vital signs collected from the patient. It could be lab results collected from the patients, or it could be the signs and symptoms manifested by the patient during the initial contact is inputted into the electronic healthcare record. Now, then computers and artificial intelligence identify data patterns and determine which data and trends are impactful to patient outcomes. This data allows healthcare organizations to generate patient summaries and provide relevant data, insights, and or potential interventions in a meaningful way. And these data that are generated will be used by providers in making decisions related to patient care. And that is how important knowledge technology is in healthcare. Now let's talk about recent technological advancement in healthcare. As I mentioned earlier, technology or technological advancement in healthcare will continue to rise in the coming years, whether we like it or not. And some of these recent technological advances are virtual reality, we also have nanotechnology, we have artificial intelligence, we have 3D bioprinting technology, and of course we have robotics, and of course there are also other recent technological advances that we have now. Virtual reality is one of the most important recent technological advances in healthcare. Nowadays, virtual reality is being used, for example, to train future surgeons and for actual surgeons to practice operations. Even some patients are using virtual reality, for example, in the mental health care settings. Virtual reality is actually used by psychiatric patients to improve their health outcomes or mental health outcomes. So imagine with this virtual reality in the future, you might be watching operations as if you welded a scalpel, or you can even travel to other countries or home while you are lying on a hospital bed. Imagine that. The next type of technological advancement is the 3D bioprinting technology. Now, this technology is very important because it could be used to replace human organ transplants. And imagine, there are several patients awaiting for organ donors. It could also speed up surgical procedures. This technology could also produce cheaper versions of required surgical tools. And of course, this technology would improve the lives of those reliant on prosthetic limbs. And this is an amazing technological advancement given the different issues that surrounds now in our society. Another important technological advancement in healthcare is the nanotechnology. Imagine a small pill, containing nanoparticles or containing nano devices that can actually provide treatment, for example, for cancers, or can operate minute surgeries inside our body, in which surgical incision will no longer be needed. Or imagine the small pills with a small camera inside inserted into our body to visualize certain parts of our body, or provides treatment, without the need to open the abdominal cavity of our patient. And this type of technology is very important, and in fact there are other countries like Japan who has started this type of technology in treating some forms of illnesses to their patients. And of course, the artificial intelligence, we have discussed this already. The algorithms produced by artificial intelligence are able to identify patterns, are able to formulate treatment plans for faster treatment or management to our patient. And as I mentioned earlier, artificial intelligence is very important because it can actually help healthcare professionals in clinical decision-making process, in determining or deciding treatments to be given to the patients. And last but not the least would be robotics. One of the most exciting and fastest growing fields of healthcare is robotics. And in the last few years, we have witnessed how robotics transformed the healthcare environment. And some of these robots which have been developed by developed countries can actually help in surgical operations, for example. Some of these robots can even have sensors, they have cameras, they have microphones, and some of these robots can even interact with healthcare professionals, with patients. And even in the field of nursing, we also have robotics. In the last few years, some other companies have developed robotic nurses who can actually help patients monitor their symptoms, to give their medications, or to monitor their physiologic conditions. And imagine with robotics in times of pandemic, wherein diseases have the high chance of being transmitted to nurses. But if we have robots who can provide care to our patient, we can actually protecting the health of our healthcare providers. In times of disasters or emergencies, in which the physical presence of healthcare providers might be at stake, again, these robots can actually provide care to victims of disasters and emergencies. And of course, in times of war, we can actually utilize these robots to provide care to victims of war or battles. So what are the implications of technological advancement to leading and managing in nursing? Technology has and will continue to transform healthcare environment. Again, as I mentioned, whether we like it or not, it will continue to transform the healthcare environment. And the rise of these technologies would mean more and added responsibilities on the part of nurse managers and leaders. And one of these is the meaningful use of these technologies. So what is this meaningful use? Nurse managers should be aware that governments, especially here in the United States of America, are providing incentives or incentive payments if hospitals are able to maintain standards and are able to manage electronic data of the patients. And the very purpose of this law, the meaningful use of law, is to promote the implementation and effective use of EHRs to improve healthcare. And there are several benefits of implementing these standards set by the Medicare and Medicaid centers. Of course, through this program, we are certain that the information entered into the patient electronic data are complete and accurate. And it means better access to information, and because these data are accurate and timely documented, one of the benefits that we can see with this law, the meaningful law, is patient empowerment. That's why as a nurse manager, you need to exploit the use of this program when monitoring documentation of your staff or nurses in the electronic health records. Another important implication is information systems quality and accreditation, especially that many hospitals here in the United States are subjected to accreditation processes, and most of these hospitals should voluntarily submit for accreditation and licensing, and some of the accrediting and licensing bodies compel many hospitals and healthcare organizations to ensure that the patient data collected through the electronic health record are of quality and are based on the standards set by these accreditation and licensing bodies. For example, the Joint Commission International, this is an accrediting body. The JCI identified standards related to complete medical record in accrediting hospitals. And in these standards, hospitals should show to JCI that the patient data documentation in the electronic medical record is accurate, it's authentic, and it's timely documented. And those hospitals who are able to adhere to the standards are given the accreditation by the JCI. Another important implication of healthcare technologies in leading and managing is ensuring nurses' informatics competencies. And we define informatics or nursing informatics as science and practice that integrates nursing, its information and knowledge, with information and communication technologies to promote the health of people, families, and communities worldwide. That's why, as a nurse manager, it is your responsibility to ensure that nurses should be provided relevant trainings and education to ensure that their informatic competencies are up to date, or that they are equipped with these competencies because they're expected to handle computers, technologies in the clinical area. And again, as I mentioned earlier, informatics competency is now included as one of the most important competencies identified by the Quality and Safety Education for Nurses. In other words, nursing students are expected to develop these competencies during nursing educations and training. And this is, again, the reason why nursing students are required to take subjects related to nursing informatics. Another implications of healthcare technology is on data privacy and security. And nurse managers should ensure that patients' data in the electronic record are protected and the system is secured and the patient's privacy is maintained. And there are several ways in how nurse managers can ensure data privacy and security. Of course, number one is password protection. This is very important, especially that when you go to the hospital, it's not only the nurse who can have an access to patients' data. Virtually all healthcare professionals who are involved in the care of the patients have an access on the patient's data. That's why each staff in the hospitals are given unique passwords and usernames. And the second one is the use of firewalls. And this is very important because the firewall protects the information in the central data repository from access by unauthorized users. In other words, those who are outside of the institution cannot access this information because it tries to prevent intruders from accessing the organization's data in its private network. And the last but not the least is that nurse managers should be able to develop organizational policies on the use and accuracy of data within the hospital organization. And these policies and procedures could be related on how to collect and enter data. It could be in the use of security measures. And all these are directed towards making sure that the patient's data are held confidential and secured. So when we talk about data privacy, one of the most important law here in the United States of America that is created to protect sensitive patient health information from being disclosed without the patient's consent or knowledge is the Healthcare Insurance Portability and Accountability Act, or this is also called as HIPAA, and in which nurses and other healthcare professionals should not disclose any important identifiers of the patient. What are these identifiers? It could be the name of the patient, phone numbers, fax numbers, email address, social security number. It could also be medical records. It could be health insurance number. It could be vehicle identifiers. It could be biometric identifiers, or even full face photographs or images. Again, these are identifiers that should be kept protected under this law. And as a nurse manager, it is very important that your nurses are able to adhere this law to avoid any liabilities under this HIPAA law.